This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Dave Wilson with you. Sarah Giosi, of course, out. She'll be back a little bit later this summer. And joining us in studio today is Dr. Ferdinand Martinez, General Surgeon, Vein and Wound Care at Mon Health. He wears a lot of other hats. We'll let him explain all that as well. Good morning, Dr. Martinez.
Hi, Dave. Thank you for having me.
Let's see. Let me get you on the right microphone. Let's try that again. Say hi again.
Hi, Dave.
That's okay. Tell you what, that microphone's not working either. It's a Monday. Grab that one with the red light on it. I don't know what's going on in here. I blame Emily. That one works.
Hey.
There he is.
Good now.
It's a Monday, you know?
I know,
what can I
yeah,
say?
Yeah.
All
It's
right.
like a Monday everywhere.
Yeah, Mondays. Hey, thanks for coming in, by the way.
Hey, thank you for having me, Dave.
All right. Well, first of all, do you go by Ferdinand?
Well, that's what my dad calls me.
Oh, okay.
Ooh.
Nobody ever goes by what Dad calls you.
Yeah.
Because
so-
usually when Dad calls you that,
I
you know
I'm
you were in trouble.
Well, you know, my friends call me Dino.
Okay.
You can call me Dr. Dino, Dr. Martinez, or Hey You.
Well, let's get to know you. Hey, you, a little bit. How do you end up at Mon Health? How do you end up in Morgantown?
Well, it's a really, really long story. You know, I was born in the Philippines. I did my med school in the Philippines. Next thing you know, I ended up in New York because I wanted something different. So I ended up doing my surgical training in Brooklyn, New York, and that was a whole lot of fun. And then one thing led to another, and that was just a whole lot of city for me. I wanted a nice country environment. I ended up, my first stop was in Waynesburg, Pennsylvania, which is just a few miles down the road. After a while there, I got an offer from Mon Health, said, want to come on board? And I said, sure, yeah, it would be fantastic. Next thing you know, I'm working with a whole bunch of great guys, from the Department of Surgery and the Wound Center and the hospital in general, and the rest is history.
Now, you kind of went into the family business here, didn't you?
Oh, yeah. Yeah, I forgot about that. Yeah. So it's like we have this tradition. My grandfather was an army surgeon back in World War II.
Wow.
My dad was a surgeon as well. And then one day I was in high school. I was just laying down in my bed, and he goes to me, son, I think you're going to be a doctor. I go, really? But, I guess I had the knack for it. I figured it out, and I really wanted to do it. And next thing you know, I'm following in his footsteps. It's been an interesting ride so far. Done some great things, helped a lot of people. Lots of work, lots of sweat, lots of blood and tears. But, it all works out in the end.
I don't know that I've asked any of our doctors this when they've come in, but it's a tough job. Like you said, it's a lot of work. It can have its certainly low points, but
Yeah.
But what drives you every day?
Wow. Well, it goes down to one basic thing. I wanted to help people. I wanted to see results from that help. I was handy with my hands, and I could think a problem through. I thought a good memory, so I could figure things out. So it was either be a lawyer, be an engineer, be a doctor. I guess heck, I love being a doctor. I can see the results. I really help people. It's out there. So, it took a lot of thinking it over and convincing myself, but in the end, here I am.
We're going to talk to Dr. Martinez coming up about vein and wound care. I know you wear a lot of different hats over
Yes, sir.
at Mon Health, so you can put that particular hat on for this next
Gotcha.
segment coming up. We'll talk vein and wound care, different conditions, how to treat them, some of the more common conditions you see, so on and so forth. We'll continue the conversation with Hey You. That's Dr. Martinez over on the other side of the table here this morning for Mon Health Talk here on WAJR. We're talking to Dr. Ferdinand Martinez, but he says only his dad calls him Ferdinand. Goes by Dino or sometimes Hey You, whatever works. Appreciate you coming in this morning.
Hey, thanks, Dave.
All right, we want to focus in on vein and wound care and some of the types of conditions, some of the more common types of conditions you see. So let's start here. What vein conditions do you treat, and how do you treat them?
Well, it's all about the big, bad, ugly varicose veins on the legs and the underlying thing called venous insufficiency that makes these varicose veins become really ugly. So that's my focus in that practice. What we do is we find these bad veins, we zap them either with a laser or we inject a chemical in them, and that closes them up. And when that happens, the blood that's supposed to be flowing through them gets redirected somewhere else. And that theoretically makes bad legs, bad veins get better.
Spider veins, varicose veins, I think we're all fairly familiar with what they are and what they look like.
Yeah.
Is it an appearance, visual problem, or there's some actual physical, physical consequences to them?
Well, it's a spectrum. First, it looks bad. Second, once you see them, they get bigger and bigger and way bigger, and that breaks down the skin. So from a visible problem to a sensation of pain and discomfort and achiness and swelling, and then you have the skin on top of that breaking down, causing non-healing wounds. So you're trying to hit the bad vein as early as you can, nip it in the bud, so to speak. So that way you don't get that big whopping open wound that's just leaking fluid everywhere. Makes for a better lifestyle afterwards, if they can walk.
Are these, what causes them? Is there a specific cause? Is it genetic? Do we inherit that from grandma or granddad, or
Yeah.
all the above?
If your mom and dad have them, the odds are you might have them too. So that's one part. It's a genetic thing. The second part is lifestyle. We get a lot of patients with bad veins who are school teachers, who work on the factory floor, who stand behind the counter in the shops, those who walk around, postmen, delivery people, everyone who's standing up where you feel that blood just settling down in your legs. Those are the ones who have a high propensity to develop these bad problems, these bad vein problems. So if you're the postman who walks around a lot, and then your mom and dad have big bad varicose veins, guess what? You're at risk.
What are some symptoms that you've got an issue and you need to get these checked out?
Well, you think, ooh, my legs feel heavy. They ache, they hurt. I'm standing up for a few hours, then it feels like I got cement blocks around my feet. It's harder to walk. Then, come on over. Let's check you out. We'll do an ultrasound. We'll see whether the veins, the blood in the veins is flowing correctly. Let's see if there's any big, bad, ugly varicose veins bulging out that we can take care of, and then we'll give you a plan of care.
You mentioned the treatment a little bit earlier. You kind of alluded to it. You said you zap the veins.
Oh, yeah.
How do you zap the veins?
Well, it's not like Han Solo. I don't have my laser blaster. We're not at the cantina, I wish it was. It would be more fun.
Yeah.
But what we actually do is I have this laser fiber I stick into the vein itself. We do it at the wound center under a sterile procedure. We stick the fiber in the vein, we thread it up, and once I'm at my target, I have a foot pedal, not the trigger, a foot pedal. I fire the laser as I'm pulling it out, and that closes the vein shut. When that happens, people go, wait a minute, aren't you going to fix the vein? Why are you closing it shut? I go, well, it's redirecting the blood somewhere else. And that's what makes your legs feel better.
And is this inpatient, outpatient, something that it sounds, you start talking about lasers and shutting off veins, it all sounds complicated, but I'm getting the impression with that grin on your face, it's not as complicated as it may
Well,
first
it's not
sound.
for me.
Well, that's a good thing.
Yeah. It's a walk-in, walk-out procedure. You come
Really?
in, we do it at the wound center. It takes about half an hour, 45 minutes to do. And you walk out. Although you do walk out with like big compression stockings on your legs, but you're walking out. We advise people, they can drive home on their own, but we advise them just to have a driver with them, just because you'll be so distracted with those compression stockings on your legs that you might not want to be, holding the steering wheel then. But, it's an in and out. You're not asleep for this. People do well. You can go back to work the day after, and you see results, visible, palpable, and, effective results within a week or two. It works.
Do you offer vein screenings?
Yes, we do. Yes, we do. We have a great staff who will, process you in, see if you have a problem to begin with. Once you pass our screen, if you come in and they say, oh, hey, our initial scan shows that you got a problem, then you end up seeing me later down the road so we can, get a clearer diagnosis and set up a plan for care for you.
By the way, the number to schedule an appointment, 304-599-3449, to schedule an appointment for one of those vein screenings. All right, we've got to squeeze in a break. We're going to talk about wound care, types of wounds you treat, how do you treat them. We'll talk about that on the other side of the break with Dr. Ferdinand Martinez, General Surgeon, Vein Wound Care. He does like 27 things over at Mon Health. He's joining us in the studio this morning as Mon Health Talk continues. Talking to Dr. Ferdinand Martinez. Yes, we're using the proper name.
Hey.
Friends call him Dino. You can call him Dr. Dino, Dr. Martinez. He'll answer to about anything he said during the break. We're talking about vein and wound care. We talked about the different types of vein conditions, generally speaking, that you treat. What about wounds? What types of wounds do you treat?
Oh, we will see any kind of wound out there. We're gonna. The thing is, the wound center exists to provide support for the other doctors in the community. Wounds that they can't figure out, that they don't want to handle, that they need help on, we will come in and take care of them.
Yeah, you really handle a wide range, anything from post-surgical,
That's right.
diabetes, burn victims, who have wounds to treat.
We have burn patients, patients with diabetic foot ulcers, wounds from radiation from, let's say, breast cancer treatment, abdominal surgeries with wounds that haven't closed up properly yet. We will find a way to help our fellow doctors out there to take care of these patients. We have the expertise. All my nurses are wound care certified. We have the tools. We have the hyperbaric chamber. We have vacuum-assisted devices. We can do some minor surgery at the wound center. Plus, we have a network of home health care services that we can make sure that our patient gets their supplies at home on time as well.
I've heard of a hyperbaric chamber.
Oh, yeah.
What is it?
Oh, it's like think of a really big torpedo tube.
Okay.
It's acrylic, but you put the patient in there, and you expose them to 100% oxygen at about 2.5 atmospheres of pressure. That's a lot of pressure, and the science says that if you put them under these conditions, it'll help stimulate wound healing. Blood vessels will start forming. Tissues exposed to 100% oxygen will start growing faster. It'll even treat infections of the bone to some extent. So it's one of our big fancy tools at the wound center. The science does work. We've seen a whole lot of people go through there, have great effects. Oh, I even put someone in with a skin graft that was getting compromised. It wasn't thriving out in the environment, so we put it under 100% oxygen. and it started, thriving. So now we have happier patients.
I know there's somebody out there listening right now who's probably stubborn, like me, going, I don't need to go to a wound doctor. I can put my own bandage on. It's much more than that, much more important than just that.
I wish it were that simple. But no, we got to find out the other reasons why the wounds don't heal. Is it a blood supply issue? Is it a nutrition issue? Do you have an infection going on? So we got lots of other specialists at the center. We got podiatrists, we got infectious disease specialists, and you have me as a surgeon. Between all of us, we can figure out what's going on.
You're covered head to toe, it sounds like.
That's right. Yes, sir.
And do I need to refer? Will I be referred to you if I'm coming to you for wound care? Am I going to be referred from my primary care physician, another doctor somewhere else, or do I call you up on my own?
We can see patients from any which way, any which direction. We will take physician referrals, but we will also take in self-referrals, people who walk in and say, I have a problem, I can't figure it out. It helps for people without family care physicians yet, patients who are coming from the emergency room and they have nowhere else to go. So if you walk in the door, we'll see how we can help you out, any which way.
For wound care, you can call 304-285-1460, 285-1460. Of course, everything's online. It is, 2019. Go to monhealth.com/wound care for more information there. And, of course, Emily, we can go to Facebook? Yeah. All right. Of course, you can go to the Mon Health Facebook page as well. Get more information there. Dr. Martinez, appreciate you stopping by this morning.
Hey, thanks. It was fun.
What are you going to do the rest of the day? You got a full day, or are you off the rest of the day?
Oh, I got stuff to do. I got patients waiting for me right now.
I thought maybe Emily would get you guys a day off for coming in here.
I wish, but, the
right.
work never ends.
Well, get to your patients. Get out of here. I'm just kidding. No, we do appreciate you stopping by. Thanks so much.
Hey, thank you, Dave.